Hypertension medications and stomach ache, understanding the connections, especially for elderly. Living with hypertension, or high blood pressure, often involves a daily regimen of medications crucial for preventing serious health complications. While these drugs are life-saving, they can sometimes bring unwelcome side effects, including the common complaint of a stomach ache. For elderly individuals, managing these medications and their potential side effects becomes even more nuanced due to age-related physiological changes and increased vulnerability. This article delves into the intricate relationship between hypertension medications and stomach pain, explores the broad landscape of stomach ache causes, and highlights the special considerations essential for medication management in older adults. Can hypertension medications cause stomach ache? Absolutely. It's a common misconception that hypertension, often dubbed the silent killer, for its lack of overt symptoms, directly causes stomach pain. However, the medications prescribed to manage it frequently list gastrointestinal, GI, upset as a potential side effect. Here's how common classes of blood pressure medications might lead to stomach ache. ACE inhibitors, e.g., lisinopril, and enalapril. These can cause general stomach upset, nausea, vomiting, and diarrhea. In rare but serious cases, they can lead to intestinal angioedema, a severe swelling in the intestines causing intense abdominal pain, which requires immediate medical attention. Angiotensin receptor blockers, ARBs, e.g., losartan, valsartan. While generally well tolerated, ARBs can also result in stomach pain, diarrhea, or indigestion. Calcium channel blockers, CCBs, e.g., amlodipine, nifedipine. Constipation is a particularly common side effect, especially with certain types like verapamil and diltiazem, due to their muscle-relaxing effects on the gut. Nausea, heartburn, and abdominal swelling can also occur. Diuretics, e.g., chlorthalidone, hydrochlorothiazide, often called water pills. These can cause stomach cramps, nausea, vomiting, stomach cramping, diarrhea, or constipation, and may also reduce appetite. Beta blockers, e.g., metoprolol, atenolol. Upset stomach, nausea, diarrhea, or constipation are possible GI side effects. It's important to remember that not everyone experiences these side effects, and their severity can vary. Often, GI issues are more noticeable when starting a new medication or increasing a dose, and they may subside as the body adjusts. Taking some medications with food can also help alleviate stomach discomfort. When stomach ache is more than just a side effect, other potential causes. Beyond medication side effects, stomach ache is an incredibly common symptom with a wide array of underlying causes. For individuals managing hypertension, it's crucial to differentiate medication-induced pain from other potential issues. Here's a broader look at common and serious causes of abdominal pain. Common and mild: indigestion, gas, constipation, diarrhea, food poisoning, viral gastroenteritis, stomach flu, and food intolerances, like lactose intolerance. Even stress and anxiety can manifest as abdominal discomfort. Inflammatory conditions: appendicitis, requiring urgent attention, diverticulitis, inflammatory bowel disease, Crohn's, ulcerative colitis, gastritis, peptic ulcers, pancreatitis, and cholecystitis, gallbladder inflammation, often due to gallstones. Organ-related issues: kidney stones, kidney infections, liver problems, like hepatitis, or spleen issues. Gynecological/urological, in individuals with ovaries/uterus menstrual cramps, ovulation pain, endometriosis, ovarian cysts, pelvic inflammatory disease, PID, ectopic pregnancy, a medical emergency, and urinary tract infections, UTIs. Serious and less common: bowel obstruction, hernia, especially if trapped, ruptured abdominal aortic aneurysm, a life-threatening emergency, ischemic colitis, reduced blood flow to the bowel, and celiac disease. Given this extensive list, any severe, persistent, or rapidly worsening stomach ache, particularly if accompanied by fever, persistent vomiting, blood in stool, or changes in consciousness, warrants immediate medical attention. Spotting medication-induced stomach ache, key clues. Determining if a medication is the culprit behind a stomach ache can be challenging, but looking for patterns helps. Timing. Did the stomach ache begin shortly after starting a new medication or increasing a dose? Does it consistently occur after taking the medication? Medication type. Is the medication known for GI side effects? Refer to the list above. Are you taking any over-the-counter drugs like NSAIDs, ibuprofen, naproxen, which are notorious for stomach irritation? Accompanying symptoms. Is the stomach ache accompanied by nausea, vomiting, diarrhea, or constipation? Information review. Check the medication's patient information leaflet for listed side effects. If you suspect your medication is causing stomach ache, never stop taking it without consulting your doctor. Abruptly discontinuing blood pressure medication can lead to dangerous blood pressure spikes. Instead, contact your healthcare provider to discuss your symptoms. They might suggest taking the medication with food, adjusting the dose, or exploring alternative treatments. Special considerations for elderly individuals. When an elderly person experiences a stomach ache, the situation demands heightened attention. Their age-related physiological changes can make symptoms less obvious, but the underlying issues potentially more serious. Atypical presentation. Elderly individuals may not exhibit classic symptoms of serious conditions. A heart attack, for example, might present as indigestion, or a severe infection as general lethargy. Pain responses can be blunted, leading to delayed diagnosis. Increased vulnerability. A weaker immune system, multiple existing health conditions, comorbidities, and reduced physiological reserve mean that even a relatively minor stomach issue can quickly lead to severe dehydration, electrolyte imbalances, or worsening of other chronic diseases. Polypharmacy and deprescribing. Elderly patients often take numerous medications, polypharmacy, significantly increasing the risk of drug interactions and cumulative side effects. Age-related declines in liver and kidney function can also lead to drug accumulation and toxicity, making even standard doses problematic. This is where deprescribing, the systematic process of identifying and discontinuing or reducing doses of medications that may be causing harm or are no longer beneficial, becomes crucial. Regularly reviewing all medications with a healthcare provider can reduce unnecessary drug burden and related side effects. Geriatric syndromes. Conditions like falls, delirium, acute confusion, and frailty are more common in elderly individuals and can be triggered or worsened by illness or medication side effects. For these reasons, any stomach ache in an elderly patient, especially if severe, persistent, or accompanied by red flag symptoms, fever, persistent vomiting, blood in stool, confusion, should prompt a prompt medical evaluation. Navigating medication changes, same class or different class. If your current hypertension medications, like amlodipine, losartan, and chlorthalidone, are causing stomach ache, your doctor will consider alternatives. This often involves a thoughtful discussion about whether to switch to a different medication within the same class or to an entirely new class. Switching within the same class. Rationale. Even within the same class, e.g., amlodipine to another CCB, losartan to another ARB, chlorthalidone to hydrochlorothiazide, subtle differences in chemical structure or metabolism can lead to variations in side effect profiles. The hope is to alleviate the specific side effect, stomach ache, while maintaining the proven blood pressure lowering mechanism and potential benefits for coexisting conditions. Pros. Predictable efficacy, preserves class-specific benefits, potentially fewer new unforeseen side effects. Cons. The stomach ache might persist if it's a true class effect for that individual. It can feel like a trial and error that takes time. Switching to a different class. Rationale: this offers a completely different mechanism of action, providing the best chance to eliminate a class-specific side effect. Pros: high likelihood of resolving the specific side effect if it's class-related. Can address compelling indications, specific drug class benefits for other health conditions. Cons: introduces a new set of potential side effects, efficacy might be less predictable, could lead to new drug interactions, and requires careful monitoring during the transition. Medications generally considered more tolerable, with caveats. While tolerable is subjective, some medications are generally preferred or require less caution in elderly individuals due to their side effect profiles. These include many first-line blood pressure medications like some ACE inhibitors and ARBs, as well as acetaminophen for pain, over NSAIDs. Newer oral anticoagulants, NOACs/DOACs, are often preferred over warfarin for ease of management. Conversely, medications with strong anticholinergic effects, e.g., some antihistamines, older antidepressants, benzodiazepines, and NSAIDs are generally used with caution or avoided in the elderly due to higher risks of confusion, falls, and GI/kidney issues. Practical steps when your doctor isn't immediately available. Recognizing that frequent doctor visits can be challenging, especially for elderly individuals, here are practical steps to manage medication concerns and GI side effects. Leverage your pharmacist. Pharmacists are highly accessible medication experts. They can review your entire medication list, prescriptions, OTCs, supplements, for potential interactions or duplications that could cause GI upset. Provide detailed counseling on expected side effects and how to mitigate them, e.g., take with food, avoid certain other medications. Suggest appropriate over-the-counter remedies for mild symptoms like indigestion or constipation. Contact your doctor directly if they identify a significant concern or need for a medication change. Help with medication synchronization to simplify your regimen. Keep a detailed symptom diary. Before you can speak to a healthcare professional, meticulously record when you take each medication, when the stomach ache starts and how long it lasts, the nature and severity of the pain, cramping, burning, dull, sharp, any other accompanying symptoms, nausea, vomiting, diarrhea, constipation, bloating, gas, heartburn. What makes the pain better or worse, e.g., eating, lying down. This detailed record provides crucial information, making your limited time with a doctor or pharmacist much more productive. Proactive lifestyle adjustments for GI comfort. Many common GI side effects can be eased with simple adjustments. These are crucial steps to take daily. For nausea/upset stomach, eat smaller, more frequent meals. Avoid very fatty, spicy, or acidic foods. Sip on clear fluids. Ginger tea or peppermint can sometimes help. For constipation, gradually increase fiber intake through fruits, vegetables, and whole grains. Ensure adequate hydration. Unless restricted by a doctor, aim for 6 to 8 glasses of water daily. Regular, light physical activity can also promote bowel regularity. For diarrhea, focus on bland, easy-to-digest foods, like the brat diet, bananas, rice, applesauce, toast. Stay well hydrated to prevent dehydration and electrolyte imbalance. General digestive health. Avoid lying down immediately after meals. Limit caffeine and alcohol if they worsen symptoms. Consider probiotics after consulting your doctor, as they may help some GI issues. Timing. If a medication consistently causes upset on an empty stomach, discuss with your pharmacist or doctor if it can be taken with food. Prioritize medication adherence. Unpleasant side effects like stomach ache are a leading cause of patients stopping their medications without medical advice. This non-adherence is a serious risk for hypertension, as uncontrolled blood pressure can lead to strokes, heart attacks, and kidney failure. Promptly addressing side effects, even with a pharmacist initially, is vital to ensure continuous, safe, and effective treatment. Be prepared for your doctor's visits. Even if visits are infrequent, make the most of them. Bring your symptom log, all your medications, or an updated list, and a clear list of questions or concerns. This efficient use of time helps your doctor make the best decisions. Conclusion: a collaborative approach to well-being. Managing hypertension, especially in the golden years, is a journey that often involves navigating the complexities of medication side effects. While the development of a stomach ache can be concerning, understanding its potential links to blood pressure medications is the first step toward effective management. For elderly individuals, this understanding is even more critical. The nuances of age-related physiological changes mean that symptoms can be deceptive, side effects more pronounced, and the need for vigilance paramount. It underscores why a seemingly minor complaint like a stomach ache should never be dismissed without proper medical evaluation. Ultimately, effective hypertension management, and indeed, overall health for elderly individuals, hinges on a collaborative partnership between the patient, their caregivers, their pharmacist, and their prescribing healthcare team. Openly communicating symptoms, diligently tracking medication effects, and engaging in informed discussions about treatment options are vital. Whether it means adjusting doses, switching to a different medication within the same class, or exploring entirely new therapeutic avenues, the goal remains the same: to achieve optimal blood pressure control with the fewest possible adverse effects, ensuring a better quality of life and sustained well-being.